As the calving seasons are starting to wind down, producers are going to switch their focus on getting those cows bred back. There are many diseases and conditions that can interfere with those cows breeding back in a timely fashion. One of those diseases is cystic ovarian disease. Cystic ovaries interfere with the normal reproductive cycle of a cow. We typically see this more often in dairy cattle than beef cattle. It's hard to define this disease. Many experts define it differently, but basically you have an enlarged follicle on the ovary that fails to ovulate. The size of those are usually 0.2 millimeters or greater. There are two different types of cysts. One is a luteal cyst and the other is a follicular cyst. Typical clinical signs that we'll see with cows that have cystic ovarian disease are anestrus, or they fail to cycle. They do not breed. Occasionally you'll see cows that are constantly in heat and breeding on a continual basis, and some cows will actually have bull-like behaviors. You know, if we're going to accurately diagnose this disease, we're usually going to notice it on rectal palpation, follow that up with an ultrasound, and then we may have to do hormonal analysis to definitely define what type of cyst it is. Approximately 50% of these cysts will spontaneously resolve. The other ones require some form of treatment. Most of the treatments are going to involve hormonal treatment. One of the common treatment therapies that veterinarians will choose is just to put these cows on some type of estrus synchronization protocol, because the drugs that are used in that are the hormones that are recommended to treat this disease. One thing to keep in mind is that once we put a cow on therapy, we need to breed that cow on her first heat cycle, since the subsequent heat cycles you may not get ovulation in those cycles. Unfortunately for beef producers, one of the problems that we run into is a lot of these are going to be diagnosed when we preg check cows, and so that's going to put them out of sync with the rest of the cow herd, which maybe it'd be a good idea to go ahead and cull those cows, since we know there is a hereditary component to this. If you'd like some more information about cystic ovarian disease, please go to the SUNUP website.